Hello, this is for trach care. So first we would go to the patient's chart, check that your order is in there for trach cares, make sure we've got the right patient, look and see what kind of tracheostomy the patient has, and then we would head to the patient's room. Hello, Mr. Blank. My name is Tricia. I'm with the respiratory care team. Today I'm going to help you clean up that area around the stoma. We like to check that twice a day, and we want to make sure it's nice and clean. We don't want to introduce any infection to that while you're here with us. So I will help you clean that. My tracheostomy is securely in place right now with the ties secured, and I have my makeshift trach there. So, all right. So first, I'm going to ask you your name and date of birth. Okay, very good. And how are you breathing right now? Okay, so we would check lung sounds, verify their oxygen status, their SpO2, make sure things are okay right now. And then I'm going to go ahead and wash my hands before we get started. So we would wash hands, and then we would make sure our kit is very handy and we have everything we need. We have our kit, we have our extra inner cannula, everything within reach. So I'll go ahead and put my gloves on. We would also have suction available. We're going to suction before we do this cleaning. So Mr. Blank, I'm going to use a little catheter and suction out extra secretions, anything you've got in that trachea airway there. So we've gotten our gloves on. So our suction would be connected already. So we'd just grab our tubing. All right, we're going to go ahead and suction, get all those extra secretions out. Does that feel a little bit better? Okay, and then we would dispose of this. And then we have our kit. So with our kit, we're going to have our 4x4s, the pre-cut ones preferably. Then we would also have our hydrogen peroxide and sterile water mix, and then just an area. I have a little tray here, so I'd have one. There's several little areas in here. So one I would have my hydrogen peroxide mixed with water. One I would have just the water, sterile water or distilled water, so that we rinse off that hydrogen peroxide. Mr. Blank, hydrogen peroxide can be a little irritating to the skin. So once I clean it, I want to clean it again, rinse it off so that it doesn't irritate your skin. So, all right, we'll go ahead and get started. We're going to place our sterile drape right across the patient. That way I don't get water everywhere or sprinkle you with something with the soap water I'm working with. All right, then we're going to remove the ties. And then I'm going to hang on to the actual stoma. Keep that securely in place while we're doing this so that we don't alter the placement at all. So then what I would do is I would remove that inner cannula. If it is disposable, I would toss it, get my new one that I had close by, place that one back in. If it is non-disposable, I would remove that one. We're going to clean it up good. So I'm going to grab my little brush here that's been in the hydrogen peroxide water mix. Go ahead and clean, hold it between my fingers over here maybe, clean that inner cannula around it, and then we're going to rinse it with that sterile saline, sterile distilled water mix that we have, or just the water, not the mix that we have, but just the water, so that we rinse that hydrogen peroxide off. And then I would put that somewhere safely to dry. Then we would have another second non-disposable cannula, or inner cannula that we would then insert. Then I'm going to clean around that area. So we are going to use Q-tips first that are in the peroxide water mix. We're going to use one Q-tip for each side surrounding, kind of clean the skin and the stoma side around it. And all four sides there. And then we're going to use this around the device itself and kind of inside a little bit. If there's any debris that you see, anything that the Q-tips are not getting, you would result with your brush very, very carefully and gently clean around that area there. Then you would do this again with just your distilled water or saline mix so that we rinse off all that hydrogen peroxide. Again, one Q-tip for each side. So going through several Q-tips here. And then rinse the outer area and inside there. Okay, so then we're going to put that dressing back on. So this is a pre-cut 4x4. You see that it's pre-cut in the middle there. This one, the reason it's pre-cut is because if we try and cut it, we might have some little strings that straggle back. And Mr. Blank, we don't want you to get those little strings to come off and go into your airway. That would not be a good thing. So we'll use this one, secure it around the stoma site. And then we are going to replace the tie. So we would pull the old tie out and we put a new one there. And I'm going to go ahead and secure this back up. So go ahead and tie these back together. Secure, tight fit. Remove this. How does that feel? Does that feel too light, too tight, or too loose? Okay, just about right. All right, and it feels like it's nice and secure. We once again would listen to the lung sounds, assess his breathing, make sure his oxygen status is good. Is there anything I can do for you before I step out? Mr. Blank, if you have any questions for me. Okay, thank you very much.